Hi guys, so I thought I'd come on and just do a really quick video, just a quick update, because I've got some news. It's not very good news, but I've got to go with the way things go. Due to COVID-19 and the delays that the medical staff have put on appointments, my MRI, which was scheduled for sometime in May, which I never had a date for, but was told continuously that I'd have my scan in May, has now been pushed back until the end of June, which is disappointing on two folds. Firstly, because of the fact that I have to wait an extra 6 to 8 weeks for my scan, which is an extra 6 to 8 weeks of anxiety that I don't really need, especially with the fact that it's causing a lot of breathlessness and heart issues and nerve pain. But on top of that, I've already had the blood tests for this scan. For those that have had MRIs before and had to have contrast, you have to have a blood test, and within 3 months of having that blood test, you're supposed to have your scan with contrast. My blood tests were done at the end of February, so my blood test will only be valid up until the 3rd of June. And unfortunately, my scan is not going to be till the end of June, which now means I have to have bloods done again, which is quite problematic for me, because I have very thready veins. They're very springy, very thin and narrow. They collapse a lot. So most of the time they have to take arterial blood, and it can take them up to half an hour anyway, when it comes to my scan, just to get a cannula into my arm just to have the contrast. So I'm not looking forward to being a pincushion again. I feel it's unnecessary because I've already had the blood test, so I don't understand why they couldn't have just left it for what it was. But obviously I have to go with the fact that, they are extremely busy with COVID-19 patients, and, I have to just be patient. It's a bit disheartening because obviously I don't have a diagnosis. I just been told it's a fluid-filled mass that is growing. I'm just hoping that it's not going to grow too big to the point where I'm going to end up having a serious issue. On top of the growth, I actually have what they think is a hemangioma, which is basically like an internal birthmark structure on my T3 spine, but it's atypical of a hemangioma, so they're not really sure. I've also got obviously the degeneration of my C5, C6 spine, but other than that, clicking and moving out of place sometimes, and causing sharp pains in my head and causing headaches, it doesn't really cause much problem. So that's my update on that. But I actually wanted to come on and actually ask you guys a couple of questions. So if you've seen some of my other videos, you'll know that I suffer with multiple gastroenterology issues, and I have to have a manometry test and pH study done. I'm a little bit concerned about the manometry test, mainly because I've had, obviously, having a lot of gastric issues. I've had sigmoidoscopies, I've had cystoscopies because of my bladder issues, I've had endoscopies, a lot of them. I've even had the nasal cannula with the camera on that goes up your nose and then down into your throat, which is how I was diagnosed with my LPR. But when they put that thing up my nose, the camera up my nose into my throat, and then pulled it out, that is a thin, very smooth wire. Wasn't too unpleasant, but when they removed it, because I've got very bad capillaries in my nasal cavity and in my stomach and my esophagus and everything like that, as soon as you put a tube down, it tends to bleed. So my nose bled for about 10 minutes after the nasal camera, and I had to stay an extra half an hour into the A&E just to make sure that it stopped before I was allowed to go home, because it was quite a heavy bleed. something that it's not uncommon for your nose to bleed if you've had something up there that's not supposed to be there. But I was bleeding more than what they would expect. So the manometry wire that they use, I believe, is about the same thickness as an endoscopy tube. So you're looking at around at least 1 centimetre or 2 thick. And it's jagged, so it's not a smooth tube. It's got sensors down it, so it's jagged. I do know that they, put some sort of, what's it called? Some like KY jelly or, some sort of solution on it to basically make it easily go through your nose and everything. But I want to know whether if anyone out there has had a manometry test done and has easily nasal bleeding like I do, whether there's some helpful tips that I can be given to help myself out before I go to the hospital. Because obviously I know they're going to lubricate it, but they only usually lubricate the end. They don't usually lubricate the whole of the tube, because obviously that can cause issues with the sensors. I also know that you're not allowed to swallow unless they tell you to. So once the tube's in place, they will give you a glass of water and they will ask you to swallow, but they'll only ask you to swallow once. For someone like me, if I have a drink of water, I have to swallow at least 3 times just to get that one sip of water down. So I'm only allowed to swallow once. So I would like to know, how can I stop myself from swallowing? What if I've got saliva and stuff in my mouth, or if I've still got water in my mouth, how can I stop myself from swallowing? So if you've had these tests done before, please comment below on some helpful tips that might be useful for me. I don't know when I'm going for them yet. The reason for that is because obviously with COVID-19 around, a lot of appointments, especially those type of appointments, have been delayed or postponed for now. I'm hoping to get them still done this year, but who knows. But it would be good to kind of do some research at the moment and try and figure out what can be beneficial to me, what could help me. I don't really get the need for the test because they already know that I have gastroesophageal reflux disease. They already know that I have dysphagia. They already know that I have my LPR and my slow dysmotility and delayed gastric emptying. So I don't really understand the need for the test. I think it's more to just check that when it comes to my dysphagia, it's not to do with the sphincters in my esophagus that is causing the dysphagia, because I know that if they are weaker, it will cause issues with swallowing. So hopefully I will find out some information after that. The pH study, I think they just want to check how much acid I've really got. So again, I'm not too worried about that, but because obviously my nasal cavities bleed, I'm presuming they're going to put it in the opposite nostril, and that wire is probably maybe 2 millimeters, if that, of thickness. So I'm not really too worried about having that. It's basically just like having an NG tube. I've not had an NG tube placed before, but I've seen other people place them and they look fairly simple and easy to do. So I'm not too worried about that one. But yeah, let me know your experiences. Let me know your solutions that helped you. And yeah, just give me some information. That'd be really, really good. And I hope you're all staying safe with COVID-19. I know that I've had a few really rough days. I did try and get out in the sun today. I'm burnt my back. I don't know if you can see. Let me have a look. You might be able to see better on this side. I've literally burnt my shoulders. You can see here. Because I was outside today with the family and I was trying to help by painting the gate, because we'd painted one side and then run out of paint. We got the paint and then I decided that I was going to sit on a stool and paint. So I did that. I painted the gate and then I painted one panelling of the side of the fence as well. I couldn't do much else because my wrists were hurting. I was using my KT tape to help, and as you can see where I've caught the sun and where my KT tape has been, it's like, but I've took my KT tape off because it was covered in paint. I'm putting some more on in a minute, but I'm completely done in right now. It's about 8 o'clock and I am totally done in. So I'm going to go to bed. But yeah, I'm just so tired. Just painting a couple of panels on a fence has done me in something woeful. I had chest pain, I couldn't breathe, the pollen was getting to me. I didn't take my pollen mask out, which is why my voice is so husky. But yeah, I'm just really tired. So I'll probably be resting for the next couple of days, but I'm really hoping that you guys are doing well. That if you're at home with children, that they're not driving you too crazy. But yeah, I put a post on my Instagram, so if you follow me on my Instagram, I put a post on about a month or so ago for a Q&A. So if you have any questions that you want to ask me, whether it's just like, how old was I when I got diagnosed and stuff like that, then you're more than welcome to ask these questions. You can DM me on my Instagram, or you can ask on here underneath any of my videos, and I will answer them on a Q&A video coming up. It is also EDS Awareness Month in May, so we'll be doing a lot about EDS in May. I might find some more questions that people challenges of stuff that people have done that I might do. But yeah, I hope you're all staying safe, and I will hope to speak to you again soon. Please, if you like this video, please give it a thumbs up and a subscribe, and comment below of your experiences from manometry and pH studies if you've had them. It would be also good to find out how you get on with a gastric emptying scan, because I've not exactly had one yet, but I'm thinking that my doctor's going to eventually send me for one. Mainly because of the fact that my barium swallow that I had showed delayed gastric emptying, and I would like to know the severity of that. So when I see him, I'm hoping that he's going to send me for that. But at the moment, he's just sending me for the manometry and pH study for now. But he did say there was a few other testings that he wanted me to have, and before we start talking about feeding tubes and stuff. So I'm thinking delayed gastric emptying is going to be done. So if you've had that done as well, please let me know how you got on with it and what I'm to expect, especially if you're in the UK, because every hospital around the country and around the world do things differently. So it'd be really good to find out how the UK handle these things, because I'm still like a newbie. I've not been diagnosed with EDS for very long. I've had it all my life. I just didn't know. So it'd be really good to find out people's experiences of these tests and what to expect from them, and how to help me relax and cope with them. I know laying on an MRI machine for 45 minutes just to have my thoracic spine MRI'd is excruciating, because I'm laying still for 45 minutes with my head in a block, my legs elevated, which means that the blood's going to my heart, which is fine. But then when I sit up, I just go really dizzy, because the blood just pools straight in my feet again, and it takes me at least 10 to 20 minutes to get up, to walk out the room. Half the time I think they hurry me out of the room, because of the fact they have other patients to see. So I try and get to the changing room and sit down in there until I feel well enough to go. But yeah, please just let me know your experiences, and I'll be back soon. Take care, look after yourselves, love you guys, speak to you again soon. Bye.